So coming to the understanding of pathophysiology. So again we can divide epistaxis as something which is primary or idiopathic, that is we do not know what is the primary cause, and we can call it as a secondary epistaxis when we know the underlying causes. So most often the etiology is not clear. It might be because of the dry conditions, mostly the environmental conditions. When it is very dry, that is going to affect the nasal humidification, that leads to the dried nasal mucosa. So it is the atmospheric, that is the dry atmospheric conditions lacking humidification which leads to the dried nasal mucosa. So this will be associated with not just the humidification is affected, it will cause the dried mucosa will lead to desiccation and the blood vessels in the nasal cavity gets exposed. So once it is exposed, it is prone for epistaxis, it is prone for bleeding. So most oftenly this is the cause. So we have all learnt about the Little's area where we find the Kesselbach's plexus from our pre-final year of MBBS, isn't it? So this Kesselbach's plexus is the most common site of the bleeding. Okay. So this is the most common site of bleeding that we see in epistaxis, and this is found in the anterior nasal septum. So this is the Little's area. Okay. So what is marked here? So this is the Little's area. So this Little's area is found on the anterior nasal septum. Why it is the most common site of bleeding? Because in this area, so this is the area where we have a network of blood vessels. So all the small blood vessels form a small network here, and when the atmospheric conditions become very dry, there is lacking of humidification. So this area becomes so desiccated and all the blood vessels which are already superficial gets exposed. So since it is in a superficial portion, this is the area which is more prone for bleeding. So as you can see here, the arteries from the anterior and posterior ethmoidal artery branches, the branches from the sphenopalatine artery, the greater palatine, the superior labial. So all these branch towards the Little's area. So this area you should understand, this is the Kesselbach's plexus. So this is the most common site of bleeding. What about the others? The other sites of the bleeding, not just the anterior nasal wall, it can happen in the lateral nasal wall as well, which is branches of the sphenopalatine. Posteriorly also the bleeding can occur. So the posteriorly, it is the posterior branch of the sphenopalatine artery which is involved, and this posterior epistaxis or the posterior bleeding point is very difficult to control with an anterior nasal packing, and this is one of the severe presentations of epistaxis. Okay, we will discuss this later on also in this presentation. So next, moving on to the risk factors. I already told you one of the risk factor is the dried atmospheric condition. Apart from that, any cause that will cause a local inflammation. Okay, so it can be a simple common cold. So the child could have had a common cold and URI just prior to the epistaxis. So this prior URI will cause an inflammation, isn't it? Rhinitis. That is the most common risk factor for an epistaxis which can occur. It's a secondary epistaxis. Mucosal drying, of course, we just discussed on it. Local trauma, very common in toddlers, preschoolers. So they keep nose picking, or they can introduce some foreign object. Most often it is a pencil, crayons, some color pencil, or some beads, even peanuts. So children are very curious. So they either try to explore through their mouths, or they just try to pick their nose, they just try to insert something in the aperture. So always rule out the local inflammation. So it could be URI, look for how is the mucosa once the bleeding is controlled. Always rule out a foreign body. A thorough anterior rhinoscopy examination is very important. Get the help of your ENT friend and do it. And other specific factors involving the local area. So it could be tumors, I told you. Epistaxis is common in the age group between 2 to 10 years of age, isn't it? So beyond this, beyond 10 years of age, when the child experiences a recurrent epistaxis, we should definitely think of a tumor, that is JNA, juvenile nasopharyngeal angiofibroma. Those are the causes that you will think beyond this age group. So, tumors is one particular cause like that, and next is systemic factors. So, whenever we see a child with epistaxis, we should never restrict to that one particular examination only. You do examine the nose and then you just forget the rest of the body. It is not like that. Examine ear, nose, throat, examine the complete systemic examination has to be done. Ask for history of bleeding diathesis, ask for history of prior admissions, any blood transfusions, do examine the abdomen, check for hepatosplenomegaly. Head to toe examination is very, very important, where you do look at the skin for any petechiae, any purpura, ecchymosis, etc. So, a thorough systemic examination is warranted even the child comes only with the simple epistaxis. If this is the first time that you are seeing that particular child, do examine completely head to toe and a systemic